Welcome back to my channel, Chronicles of a Student Midwife. Today we'll be talking about who is a midwife. I've asked people, ask me, are you a nurse? I'm like, no, I'm a student midwife. I'm studying to be a midwife. And so that's just what we'll talk about today. Who is a midwife? Do you know that a midwife is actually first mentioned in the Bible? So I did some studying, and the first place that a midwife was talked about was in Genesis. Wow, in the beginning, right? And it's in Genesis 35:17. And it came to pass when she was in hard labor that the midwife said unto her, Fear not, thou shalt have this son also. And this is actually Rachel when she was pregnant with Benjamin. And so we see that midwives are, they've been around for a long time. And also in Genesis 38 it talks about another midwife that helped Judah's wife, kind of, not really wife, the person he had, it was his child. Anyways, read more chapter Genesis 38 if you want to know more about that. Next place that midwife is mentioned is in Exodus 15, and this is just so amazing, the story. If you have time, you should definitely read it. And it's Exodus chapter 15, and it starts from Exodus chapter 1 verse 15 through 21. And it talks about how the king of Egypt called these two midwives. They were actually Hebrews, and their names were Puah and Shiphrah. And it's interesting because it says, and I'll just read it. And the king of Egypt spake to the Hebrew midwives, of which the name of the one was Shiphrah, and the name of the other Puah. And he said, When you do the office of a midwife to the Hebrew women, and see them upon the stools, if it be a son, then you shall kill him, but if it be a daughter, then she shall live. But the midwives feared God, and did not as the king of Egypt commanded them, but saved the men children alive. And it's interesting that these midwives, they were Hebrews, so they knew the true God, and they feared God. They wouldn't kill a child, right? And that's just amazing to note. To verse 20, that says, Therefore God dealt well with the midwives, and the people multiplied and waxed very mighty. So God actually used the midwives to grow the nation, because they did not follow what the king said to kill all the male children. And verse 21 says, And it came to pass, because the midwives feared God, that he gave them houses. So God bless the midwives. That's good to know. Anyways, I did a little bit more study, and I looked up, in the Hebrew times, it names means something, and it usually means what the parent want their kids to be like, or maybe what they are like, like their personality. And so I looked up Puah, and Puah means a baby soother or a whisperer, and it can also mean glitter or brilliancy. So it means that Puah was a brilliant person. She was intellectually brilliant. So it's not just someone that, wasn't trained, or just came out of, somewhere and just started acting as a midwife. No, she was brilliant. She knew what she was doing. And Shiphrah means beautiful. It means fair. It means bright. So Shiphrah was a beautiful person, and she was bright. And I guess she was intellectual too, right? So as midwives, as student aspiring to be midwives, we should be, all of us, whatever you do, we should know what we're doing well, right? We should do our best for God. And it's interesting that, this was called the office of a midwife. It says when you do the office of a midwife. And back to the Bible, because in the Bible times, there were few places where an office is actually mentioned. Like king to be a king, it's like an office. You just don't wake up and you're like, oh, I'm royal and I can be a king. No, it's not like that. And also to be a prophet also is like that. Is it prophet or priest? I think it's a priest. To be a priest is also like that. You have to be, born into the lineage, and it's an office. And it also called this, an office. And I think Puah and Shifra, they didn't just wake up one day and they became midwives, but they they were trained to be midwives. And that's amazing. So down with the Bible now. When did this story happen? And there was no like concise time, but what I saw was that this happened around 1500, before Christ was even born. And that was amazing because that's a long time for midwives to be around, and it does make sense. I mean, since creation, women have been given birth, and birth is a natural process, and it's amazing how God, designed us to our bodies to reproduce, and just this, it's a power to be able to reproduce something else, to give life. God is the creator, and he's able to give life, and because we are made in his image, he's giving us the power to give life. This is really amazing. So I looked up, so when you say a midwife, what does she do? And it's just someone that assists a mother in labor. That's actually just the meaning. A trained person that assists women in childbirth. And pathways to midwifery. Most people is to become a nurse, and then you go ahead and you specialize in midwifery. So you go through more education, and there's some people that just go to that education first. They become midwives first. And the path that I'm going through is it's the midwifery. So I went to a midwifery school, and I was there for 3 years. It was a 3-year training, and right now I'm on my clinicals with a midwife that has her own practice, and I work alongside with her. And God is blessed that I'm able to work also with other midwives. So midwives, I have such a high respect for midwives because they're so skilled, they're so knowledgeable. I mean, it's just amazing how much they do and how much they know. It's they're just like everything. They're like the doctors, they're like the nurses, they're like the mothers, they're the midwives, they're the pediatricians, they are whatever, the doulas, I mean, they're just really, really knowledgeable. So I am going through the PEP process. It's called NARM PEP process, and NARM stands for North America Registry of Midwives, and they are like a certifying body. So you go through a lot of requirements, and when you're done, you take your board exam, and actually right now you have to be at least in training, like in the practical sense of being a midwife, for at least 3 years. So that's a long time. So if I'm counting 3 years of my midwifery, of my book work, and then 3 years of my being in clinical training, that's like 6 years. I mean, that's a long time, right? But it's just so you really know what you're doing, and you could learn as much as you can and see different situations, because the more different situations you are, the better. I said before that childbirth is natural. I mean, we all know that, right? Women can give birth without anyone being there, without a trained professional. But because of sin, we are not the same as we were created. We're not perfect or anything like that. We have sickness, and we have disease, and we have, just different things that could go wrong. And that's why you need a trained professional during your birth. PMs are trained in out of hospital birth. So we're trained to undo emergencies, like neonatal resuscitation. You know, if your baby comes out blue, no breathing, we can, you know, help resuscitate the baby. We deal with hemorrhage. If the mom is bleeding too much, which if she loses too much blood, she could die, right? Or she could go into not very good situation. So we trained in that. We train in different other complications, you know, like if you have like a surprise breech or shoulder dystocia or anything else like this. So we're just training just those different scenarios to be able to just, yeah, be ready. So birth is natural, right? It's a natural process. But if something goes wrong, what are you gonna do if you're in your home or somewhere else or by yourself? And that's why you need a midwife there. Midwives are very skilled. They know their stuff. They respect the natural process of our body, you know, giving birth, and they try to guide that as much as possible. If you're looking for, you know, doing things more the natural way and just wanting no inventions whatsoever, and if you want someone that would just, you know, honor what you want for your births, you want to birth in the comfort of your home, you know, you want to stay home and just be where you are, where you know. Or if you want to birth in a birthing center or anything like that, contact a midwife. And yeah, so the question of the day is, did a midwife attend your birth? If she did, what was the experience? I know you weren't there, but ask your mom. And so yeah, God bless, and thank you for watching my channel. Testing. Hello, welcome back. Okay, let's start again.